Thanks a lot. Thanks for being here. And thanks, Claudia, because by implication, you said that in case of fire, I'll be the first one to escape. And everyone can follow me. Welcome, everyone, and thanks for joining us here today. Professor Al Ross is a chartered ergonomist, a chartered psychologist, and professor of health systems in our School of Health, Education, Policing, and Sciences. A human factors expert and leading figure in safety science, Al has worked in fields as diverse as policing, nuclear, and transport industry. In April 2023, Al joined the University of Staffordshire and currently oversees our master's courses in human factors for patient safety, teaching health and care professionals from all disciplines. We're very excited to have Al here at the University of Staffordshire, teaching the future generation of healthcare professionals and sharing his vast knowledge with our students and with all of us today. I hope you enjoy this lecture, and I greatly look forward to hearing about Al's career and journey to today. That was my written script. But before I ask you to put your hands together to welcome Al, let me say something from the heart. Very rarely it happens that you are in a senior university leadership role and the mention of a professor comes up, and the colleagues on the research side responsible for research leadership sing their praises, and then they say, they're great professor, great researcher. And then you speak to the academic department, the teaching department, and the academic colleagues say, they are a great teacher. You speak to the students, and they also sing their praises. And you speak to the dean, and the dean also says, oh, excellent team player. In our world, I wish that there are more professors who have the reputation that Al does. So we are all really looking forward to finding out more about Al's research and his journey in life. May I request you to give a very warm welcome to Professor Al Ross.
Thank you very much indeed for that introduction, and thanks for your attendance, and thanks for the invitation to speak. We have the clicker problem to start with, which we did rehearse. Yeah. Thank you. I'll just start. I was once told in a job interview that my CV was very broad. So I beamed a big smile and then realized it wasn't a compliment, it was a criticism. So I think what I'm partly doing here is trying to make sense of that. And I'm citing here one of Stoke's most famous philosophers. And I think part of the reason it's broad is I'm still searching for something. I'm still looking for things to get interested in, things to study, and ways to do it, methodologies. And maybe that's the game. Maybe when you get all that sorted out in your head, that's the end rather than the beginning. So maybe the search is what's important. Human factors then, which was mentioned. What we do is, that's the first reason it's broad, is I do all that searching within this discipline. And it's a very broad discipline. It's the study of work, from the Greek, ergon, nomos, the laws of work. And so we take systems as our unit of analysis, which is important. So it's a broad unit of analysis. So we always conceptualize people with goals and tasks and tools, technology and equipment to help them in a physical built environment and a cultural and social environment as the unit of analysis. So that's why we study different systems, because if you like, that's our data point. If you only looked at one system, it would be a bit like an orthopedic surgeon just looking at one leg for their whole career. So we have to look at different systems. And because of these interacting elements, it's also an interdisciplinary science, right? So we say pluralistic. So we pinch ideas from psychology, engineering and safety science, the management sciences, and the physical sciences. Again, that broadens you out because you have to start reading journals in these areas and going to conferences in these areas and getting ideas from that cross-fertilization. Importantly, it's not like a biomedical science, which people will know about, or a social science. It's really a design or an engineering-based science. It's got more in common with things like architecture and the designing of systems. And probably human factors is encapsulated more or less by the description on the bottom left. We're doing human-centered or user-centered design to take into account people's capabilities and limitations. We say making it easy to do the right thing. That's what our intent is. And all the professional societies here will tell you much the same thing. It's also got a purpose. It's an applied rather than a pure science, which means we're trying to do something. We're trying to improve things. So we're looking at the elements and taking a principled design approach to improve things. And we say we're trying to optimize well-being and system performance. We call these the twin aims of human factors, hence the picture of my twin, Marvin, here in the little town in Scotland, Calendar, where we grew up. And we always look at the outcomes in the round as well. So people generally don't do that. So people in healthcare systems will say, I want to improve efficiency. And someone else, well, I want to reduce certain safety incidents. And someone else say, well, I want to retain staff. Well, all of those things are interlinked. You have to look at them all together, because otherwise, if you don't, then you'll have unintended consequences elsewhere in the system. So there's a relationship between safety, efficiency, staff well-being, resources, and everything else. So we're always looking at outcomes in the round as well. So you can see the breadth there. But the other reason my CV is broad is just life, events, as Macmillan says. And all of this stuff is in the story, so I better get on with it. And I'm still unsure as to the extent to which I'm in control of my own destiny. I'm still grappling with that. Did I come here today? Did I really plan this or engineer this in some way, or did life just happen? So it starts destiny in Levern Crescent in Barrhead, East Renfrewshire. My mum lives on the bottom right and my dad on the top left. And the story goes that my dad is forfeited, I think there's a party going on, he's about 20, to go down and knock on my mum's family front door and offer to scrub the steps, right? He gets a dare, and he goes and offers to scrub the steps, and he scrubs the steps, and he must have caught my mum's eye and done a good job of this, because they were inseparable after that, until my dad's death from throat cancer in 2002. It still frames everything for us, that event. But my parents gave me a platform, a material platform. They worked hard for 4 children, but they also taught us to do what we wanted to do and try and do it to the best of our ability. And if I can put it very bluntly, they taught us things like right from wrong, which I consider a privilege in my happy childhood. And I hope my mum's Wi-Fi is working in Dunblane and she's watching, and cheers, Mum. But the platform wasn't anything to do with ergonomic influences or health services research or anything. It was social and musical that were our influences. My dad was a social worker and a dance band drummer, and my mum was a very accomplished singer, piano player, and trained as a music teacher, and sacrificed that career for the children, by the way, in this week of International Women's Day. And so the social comes first, and then the musical. So I go off to Edinburgh, 1984, study social science. I get an ordinary degree, BSc ordinary in social science, so I didn't exactly set the heather alight academically. But apologies to the Pro-VC, I do remember occupying university buildings in support of the then striking miners, so I'm not endorsing that sort of behaviour, obviously, anymore. But I get exposed to psychology, and I think that's quite an interesting subject. I get a couple of years of undergrad psychology. But nobody's wanting to employ me with my ordinary degree, so I go back home and I open a record shop called Helter Skelter, and I quickly realise it's going to be a social success. It's quite good fun, but I'm no Richard Branson, right? It's not a commercial success, the record shop. This is in the late 80s. But going home is the most important thing I ever did, because I meet Leslie Abernethy. Les and I have been together 37 years, and she hasn't aged a day. I mean, I'm unrecognisable. And I have one piece of career advice: follow the girl. The career will be fine if you've got the relationships right. If you don't get the relationships right, what's it for? And it's definitely a team, and I'm the flower, by the way, in this sort of team. Leslie does something very important, though, at that stage for me. She leaves. She goes away to art school. And that leaves me thinking there might be something beyond small-town retail. And the Glasgow School of Art, subsequently, it was a very famous building, burns down. And I watched, by a curious twist of fate, I watched this fire on the left from very close quarters, because I'm teaching final year dental students in the final year clinical exams. As the clinic fills with smoke, the flames go up, and the Sky news crews and the fire engines all arrive downstairs. It was quite a day and quite an event. And the art school subsequently burnt down again during the refurbishment. And there's a lot of conspiracy in Glasgow about that event, so it's burnt down twice. So Leslie's away to art school. I think, what about psychology? And I go to Hull. I have a great year in Hull. I convert to psychology. Some psychologists might know about the conversion course. And what's important is I study with people from other disciplines, because we're all coming to do psychology from other degrees. So I study with physiologists, people who've done pharmacology and things. It's really interesting to me to learn from other disciplines, and that's what our students do. They're all from all over healthcare, and they come together to study ergonomics and human factors. So I think I retained that idea that was somehow a good student group. I do a master's in research methods, and then I get a job in the Centre for Applied Social Psychology, or a CASP, in Strathclyde. And I basically do the work of the unit as a good research assistant, which is drugs and alcohol stuff. Some really interesting stuff around the prohibition of smoking in enclosed public spaces, part of a consortium there. And I might have stayed there, who knows, I don't know, but events are about to take a turn. But I'm forming ideas there. I form clear ideas about the importance of social and environmental drivers. A lot of the drug and alcohol stuff at the time is very behavioural and focused on individual factors. And quite frankly, I watched it fail. People would be taken out to the countryside to a big posh house and given medical rehab, and they would get clean. They would be clean, and then they would be taken in a taxi and dumped back in Possil, in the north of Glasgow, and they had relapsed by Friday night because, quite frankly, they had a poverty problem, not a drug problem. So I become convinced that there's essentially systems. Let's say social and environmental factors have to be taken into account. And it's still the case that those are the drivers. I also become convinced that people are complex, outcomes are complex, and there's not going to be one-size-fits-all intervention for this, which I still retain as well. So I'm forming ideas there. But this report is really interesting, despite the fact that I'm a footnote on the right in the acknowledgements. There's a reason for that. Basically what happens is the unit gets an alcohol grant from the WHO, but it's alcohol in the workplace. So what do you think this brings into play? Well, it brings accidents, incidents, health and safety, inquiries and investigations, culture, procedures, and documents. So suddenly the unit is now in the game of what we would now call sort of essentially macroergonomics. So I'll leave that thought with you for a second. So I go sideways for a minute. So I go to John Davis, and John is the director of the unit. And I say, John, you know I'm in this band, because by this time I'm in a band with a friend of Leslie's from art school. And he doesn't look at me as if to say, what's coming next? He looks at me as if to say, I know what's coming next. Because John was a very accomplished musician. He was a chorister in Manchester Cathedral Choir. He was a French horn player in the National Youth Orchestra. He led the Strathclyde Uni Big Band for many years, and he was in this jazz band in the 70s, head man. And so when I say to John, well, the band's got this publishing deal with Sony, and he says, stop there. He says, you've got to do it. You have to do it. You have to do the band. You have to follow the dream, get it out your system, because otherwise work will never be fulfilling. And he says, when you're finished and it goes badly wrong, which it will, come back and I'll see if I can get you a job. So that's quite something that John did for me. And John was a friend and sadly died. And so I did. And so there's 4 green Scotsmen sitting on a wall. This is the 3 years, and I'm not going to talk at all about this, apart from to say that I went to check this week if we'd ever played in Stoke, and yep, we sure came through Stoke. We were playing in a place a few times called The Stage in Hanley, and apparently it's no more, as is the band. So after that, I go back to John, and he says, how do you fancy going round nuclear power stations and finding out how they tick? Of course, 3 years has passed. That workplace stuff has grown arms and legs, and we're now in the safety game, if you like. So I spend a year with the operational experience feedback engineers going around the country, the length and breadth of the country, and I mean that literally, because nuclear power stations are literally the furthest places from habitation that you can imagine. So it's coastline stuff. And these are the safety people, and they are known as the bad news bears in nuclear, because they're the people that are talking about risk and harm and events, basically talking about blowing up the eastern seaboard of Scotland here with tornadoes. The marketing people are all about profitability. They don't want to hear all that bad news. And it's my first exposure to that fundamental trade-off between safety and efficiency, literal arguments about whether or not you could shut things down for safety reasons. But really get into that, and if any students are watching on the stream, I think this is my first use of the term human factors, but I'm getting it wrong, we are. So this says human factors, but it's not the discipline, it's the collective noun of stuff. Human factors as in stuff about humans. And that's a journey that a lot of our students go on, is coming to that formulation of the science versus the topic. So I've walked a mile in those shoes back in, this is the late 90s. And that, however, exposes me to where I think I want to go. I get interested essentially in safety science. Play with the chronology for 1 second. This is John and Linda Wright looking enigmatic here. ScotRail, much to their credit, decide that they don't want to wait for train crashes to try and learn lessons to then fix problems, because we've already had the harm events. And they say, why don't we collect confidentially reports from train drivers on near misses and on things that we wouldn't normally hear about, just things that they think could lead to accidents. Really forward thinking, really proactive. And they get that contract going with John in the unit. I'm away at this point, which I'll mention. And then the sad events of the Paddington rail crash happened in 1999, also known as Ladbroke Grove. And John Prescott, who is the then Transport Minister, mandates this small Cyrus system from Strathclyde University across the whole of Great Britain, England, Wales, Scotland. Suddenly, overnight, 70,000 people can report into this system. So John has to crew this. The research contract becomes massive, and we have centres for data collection, W.S. Atkins and Farnborough down south with the ministry. And John phones me up and said, we've got all these reports going to come in. They come leaflets and phone calls. I need a data manager for the whole system. He says, leave your PhD, which is what I was doing, and come and work for me. It's not the best supervision model, Jane, sorry about that. But I do it. Right? He says, don't worry, we'll get your PhD part-time. So I go and work for the Cyrus system as the first UK data manager. It's still going. It's now nearly 30 years old. It's in the 25-year retrospective, Greg Morse says that grant to Strathclyde, initiated by ScotRail, was the first serious move to understand human factors in the rail industry, and is an important part of the historical evolution of safety culture in the railway. So a very small part I played, but that's a legacy that's ongoing. And so basically that continues. We spin out the unit, spins out a consultancy firm, because Strathclyde are an entrepreneurial-facing organisation and they like that stuff. I retain an interest in the department, but I work for the consultancy basically as a principal psychologist. It's called Human Factors Analysts. We do work across industry. There's a lot on this slide, but I think a lot of this stuff is current as well as historical. The top quote, it's better to know what's happening than who's doing it. That's targeting blame culture, if you like. That's trying to have an open culture. The second one is about complexity. There's certain things we can only predict within reasonable margins because of an uncertain, essentially complex and chaotic world. The third one's about the myth of root cause analysis, identifying dozens of causes of the last disaster and trying to learn that way. And related to that, the bottom one, I like it, prevention requires imagination. And the bottom quote, we're saying, wouldn't it be good to learn from things before we have to undergo the experience of the harm and the events? Can we not get to leading indicators and learn? I think all of that stuff was ahead of its time. The book is called a qualitative systems approach. Now in the NHS, a lot of people, it's embedded in the contract, and a lot of people talk about systems approaches, but believe me, this is over 20 years ago, everybody was talking about behavioural stuff and human error and telling people what to do rather than trying to understand systems. So I think that is, and I think beyond human error, this book is sort of self-explanatory, except that we're talking about systems theory. And I think we're the first people ever to talk about general systems theory in this context. And I think it stands the test of time, this stuff. And it's like, we were ahead of the curve a little bit talking about these things. Remember what I said at the beginning, that complex mix of people, task, tools, environment gives rise to a complex mix of outcomes, and that's what we mean by systems theory. We have to try and deal with all that complexity and not pretend it's easy and pretend it's simple. But my PhD comes about from an email from an Olympian, Myra Nimmo, who's a professor of exercise physiology and runs the Scottish School of Sport Studies. And Myra became Pro-VC of, I think, Birmingham, boo hiss, and was also chair of England athletics latterly. And I think she's emeritus now. And the PhD opportunity says, start tomorrow, any topic you like, fully funded. So I think, well, this is quite interesting. And I've become interested in exercise. I started racing mountain bikes in '97, trying to get fit after the band. And so I go and start my PhD and do it in the Scottish School of Sport Studies. I interview a girl who's 15, who I won't name because she's a research participant as part of my PhD, and she subsequently makes London 2012 as an Olympian, followed her career with interest after that early beginning. And I say this is the end of psychology. I become really convinced by something that's annoying me, which is the deep interconnection of the physical and the psychological. I have to do a lot of lab work as part of my stipend with the physiologists and the biomechanics stuff. And I start to think there's something difficult about divorcing psychology from the physical and the context. We work in heat chambers, and I can't get psychology away from the fatigue and the skill and the motor skills and all that stuff. So there's something forming there. The Scottish School of Sport Studies then burns down just as I graduate. So I get away with it. I graduate with my PhD 2003, 6 months after my father passed away. It was a hard time, but my mum was proudly in attendance. So the physiology students lost data which was stored in fridges. So I'm not saying that the Centre for Health Innovation here is under great threat, but I seem to be leaving a trail of devastation behind me everywhere I go. And trigger warning. Bear with me here. I'm trying not to derail this talk at this stage. We'll get there in the end. We invite this guy called Mark Johnson to a conference we run in Glasgow. I hope he's still alive. The last I checked, he was emeritus at Oregon. And he gave the most beautiful, poetic talk that has stayed with me. This is 20 years on. And think what I just said. I said, trigger warning. Well, that's a metaphor for a relatively recent metaphor for a gun trigger. Bear with me, that's a proximity metaphor. Bear with me. We'll get there in the end. That's a journey metaphor. Do you grasp what I'm saying? There's another one from the physical grasping. Okay? Are we singing from the same hymn sheet? There's another one. And Mark Johnson's book is called, with George Lakoff, it's called Metaphors We Live By. And his argument is that we've convinced ourselves that psychology, cognition if you like, is something reified and separate from our physical beings in the world, and in fact we're animals. And it's just by a series of metaphors that we do that. You know, I say I don't want to derail the talk. It's a metaphor from the physical. From the physical. I'll leave that with you as a little earworm. That's another metaphor. And that's his argument that we've got this, we call it dualism between the mind and the body that doesn't really work. We have to get back to the intertwining of the physical and the cognitive and the environment. So again, we're back to the beginning of Human Factors. We are physical beings in a world, and cognition, decisions are deeply intertwined with that. Now, this is the philosophical bit. But in healthcare, people's decisions are taken in that rational way out of context. Someone made an error, like they were a computer. You know, they did something in the abstract. There's very few healthcare investigation reports that will ever say that someone's feet were killing them and they hadn't had a drink since 7 in the morning and they were dying for the toilet and it was roasting hot. That stuff's like it's not part of the story. But how can that not be part of the story? Because that's the nature of human existence. Deeply intertwined with your decision-making, how tired you are, again, context, as well as the culture. So I just become convinced with this stuff. And the book that comes from the conference is called The Mind, the Body, and the World. And we're saying put the mind in the body, put the body in the world, and try and get to an understanding of human behavior and existence in that sense. And this is what we call post-cognitivism. But it's basically a grounding of psychology in context. So I come with that to my first ever patient safety job, which isn't that long ago, but in the story it's relatively late on, about 2010. There's another member of the cabinet here, Annalise Dodds, ex-member of the cabinet, isn't she now? Yeah. She became Shadow Chancellor and then just resigned in protest at Keir Starmer's stripping of the foreign aid budget. So she leaves a post in the NIHR Patient Safety Unit. Janet Anderson, who becomes a close colleague, then advertises for a replacement, if you like. She steps into the Annalise Dodds role. I come in as the research fellow. And I say to Les, I'm going to London 15 months. She said, okay, if you must. Patient Safety Fellowship. And it's Janet that encourages me to complete my chartership with the Ergonomics and Human Factors Institute. And Janet says, there's this interesting guy in southern Denmark, and he's talking about how patient safety is all about harm events and adverse events, and we investigate them and we find out what went wrong, and that's how we learn. We learn essentially from mistakes and from bad things. And he says, why don't we try and learn from how things go when that doesn't happen, essentially how they go well and how we create success? Because we don't really know about that. We never study it. We never specify it. And it is a deep psychological bias, if you like, to focus on the negative. If you were late for something like this, you would come in and you would say, the car wouldn't start and the bus was late and, I forgot my brolly and all the rest of it. And you would explain yourself. If you come in on time to a meeting, you never say, you never guess what happened. I set my alarm, I got up on time, I laid my stuff out in advance and I'm here, because we've no motivation to study that. But that's something to learn from as well. If you want people to get there on time, surely you would learn from the people that get there on time as well as the people who stuffed it up. So I think that sounds good. So she said, his name's Eric Holnagel. I said, I know this guy. He came to the Strathclyde conference and he wrote a chapter for our book as well. So we start going over to Denmark. And this is the good news bears, I'm putting it simply, right? This is the people who are interested in how safety gets created, not bad things, but how things get done. And this has become, it's called Resilient Healthcare Network, became a society, and its shorthand for this is what people now call Safety 2, because Safety 1 is, if you like, simplistically, but Safety 1 is kind of what goes wrong. Safety 2 is how do we actually create safety? So it's that complementary picture, and I've become quite convinced that this is a good area to work in. And Janet and I get a grant from the guys in St Thomas's charity. It's quite large, and we set up the first centre worldwide to apply these ideas. How can we learn from this stuff? We've got the Centre for Applied Resilience in Healthcare. How can we learn from teams that are resilient and organisations that get things done? I also become quite interested in the healthcare simulation, not so much as an education and training modality, but I'm fed up with questionnaires and interviews, the stock and trade of psychology. I like the simulation of practice because you can watch things move, it's moving parts, sort of bridge to real observations. And so I get involved in that, and I run courses for the London Deanery, and Dr. Peter J. employed me in the trust to run human factors courses, simulation, but again with that view to using it as a way to study the complexity of work, so I still quite like that. And that research continues. I've applied that kind of resilience stuff in a whole load of different contexts and still continue to try and grapple with that. And we produced a handbook that is freely available. It's trying to describe how you might do this type of research and quality improvement from this kind of idea. It's the same sort of stuff, but we just sort of see often staff as a source of success, so they're not a fly in the ointment all the time that get things wrong and stuff up systems. Mostly, individuals, teams, and good performing units are there because people are, monitoring, responding, learning, and getting things done despite difficulties which we know about in demand and capacity and resources and so on. So we're trying to learn from the units that do well and the teams that do well. But it's a long way from London to Glasgow. It's 40 hours by bike. I don't normally go up the M6 like this. I used to cycle through Lincolnshire and Teesdale. So because family are up there, and I've included my other two siblings for completeness, Graham and Katrina, and Leslie's up there, I go home. And I only go home for family, but I get a job in Glasgow Dental School. I lecture in behavioural science, so hopefully by now you've realised I don't think that's really what I want to do, but I just convinced them that actually what they really want, once I get the job, obviously, is a lecturer in human factors, and I make that transition when I get the senior lectureship. And I was supported by a really good head of school, Professor Jeremy Bagg, and a head of research, Professor Lorna McPherson. But this is where I get my first real teaching roles. I teach a whole load of communication stuff across all the years of undergraduate dental education. And importantly, I run the elective study program, and I get convinced by how essentially the learning outcomes from self-directed learning, because students in the elective program choose their own topic, they choose their own methods if they want to, how they want to approach things. And I think this is good. Now, if any of our students are watching, and Professor Bowie knows, some of them hate it. Some of them would much rather they were told what to study, what to do, and then we would assess them. But we charge them with going and finding their own subjects, their own systems, their own issues that they want to approach in human factors. So I think that has stayed with me, teaching-wise. I do a lot of public health research. We get grants from the European Commission, the Scottish Government that are major, and some of that stuff is ongoing because I'm still sort of publishing some stuff in head and neck cancer systems, again looking at systems, from the recognition of symptoms through presenting at primary care, through into secondary care and to diagnosis, trying to look at that whole system, and the same with dental public health for childhood decay and so on, looking at everything, education, diet, all the rest of it. And probably the ideas kind of dry up here. This is probably the end. I've become convinced that, again, that there's a direct parallel between public health and human factors, and the evidence in human factors is still emerging. It still needs to have a major impact. But in public health, the jury's back in. We absolutely know from public health that only systems approaches work. No amount of education, all the awareness campaigns and everything will work. The evidence is very, very clear. You cannot win the world like one chairside consultation at a time. You have to move into structure, access, pricing, and all of those things if you want to have effects. So, I've took the war on error. It's what we call downstream. That's another metaphor, by the way. Downstream, the war on drugs, the war on obesity. They're all too individualistic and too much on behaviour and awareness, and they need to get up into systems. So, just got a short time then to come to Staffordshire. Basically, I'm I'm okay in Glasgow. But I meet Professor Sarah Jane Jones, who apparently has a better offer tonight. She's my line manager, but has decided to go off to 10 Downing Street to meet the Prime Minister. I presume that was a difficult decision. But I meet her because, by chance, we examine a PhD together. She's the external, I'm the internal. Then I'm having a conversation with Professor Paul Bowie in a public bar in Glasgow, and he says, I'm teaching in Stafford. And I say, where's that? He said, and he says, they're good folk. He said, they're a good bunch. That's what he said. And he says, is this Sarah Jane Jones? I said, I've met her. I've seen her before. So anyway, for some reason, I apply for the job. And I have a very stressful job interview because I'm not good at them. And I wake up to a pan-flat tyre in the Premier Inn in North Stafford in the morning. So basically pitch up covered in oil. And I'm offered the job. And I'm very grateful for the opportunity. So just a wee bit of teaching and research. As was mentioned by the Pro VC, I lead the course, and Paul's with me on this, in Human Factors for Patient Safety. It's all of that stuff. It's the mind, the world, and the body, or the mind, the body, and the world. We teach cognitive, physical, and organizational ergonomics, and then we try and put it all together into a systems approach. It's that model that's been gathered over all these these grapplings with this stuff. That's what we do, and that's how our course is laid out. And I should have mentioned we're newly accredited with the Institute as a full qualifying course, which confers graduate membership of the Institute on our students. We're the second healthcare course in the UK, I think, to achieve that, and we're proud of that. And that going forward, I think that's a real string to our bow. It's very unfair to single out any particular groups of our student body, but I've done it anyway. We're delighted we've got social care represented. That's such an important linked part of the system. A lot of human factors and patient safety stuff is very hospital-based. We've got the CQC, so we've got the regulator as part of our representation. Again, so important. I think we're probably unique in a course where you would have someone from the regulation side learning alongside people from the service. And I'm very tickled to have someone coming into the April cohort whose background as a hospital porter. I mean, what a forgotten part of the system that is. And all of these people give us a wealth of things to learn from in terms of how systems work and how complex they are and how beautiful and dangerous and vibrant and dynamic they are. And it gets me up in the morning to hear the stories from all our students. Finishing with some of the research that I've brought, I brought a little bit of a component part of this grant. It's a global oral health grant. Professor Richard Watt is the principal investigator from UCL. We're in India, Kenya, Brazil, and Colombia. And again, we're doing systems reform. We're trying to reach communities out there, mostly rural communities and also vulnerable urban communities. We're looking at trying to do, again, joined up stuff. Right? Community engagement, looking at access to services, looking at the commercial influences that are there and trying to reform systems. So ambitious, long-term grant there, and I brought that with me a little bit. I'm delighted to be involved in a small way with a project that Lizzie Crisp initiated and conceptualized. She said, why don't we use this human factors system model, people, tools, technology, and so on, and try and improve maternity investigations? It's really innovative. We've got funding. I think Paul's on that as well. From the Health Foundation, that's ongoing, and delighted to be part of that team. And I'm going to be the director. Our little research group was called ResNet. It's going to be a formal research centre now within the school. Delighted to that. I'm supported in that by Hazel Ann Smith, who's the centre there. And I've said close collaboration with other research centres. What I really mean is trying to pinch knowledge from Naomi and Claire because they know what it's all about, running the research centres. I don't know what I'm doing yet. So close collaboration as in me asking them how to get started in that. But that's quite exciting. That's going to be launching this year. And I'm just going to finish with a study, very briefly. And this is the second piece of career advice. It's like, get back on the tools every now and again. Do you know what I mean by that? It's another metaphor, right? Don't lose sight of what got you interested in stuff in the first place. And you can promote yourself quite easily to a life of drudgery in my mind, right? Some people love management and administration, but you can promote yourself to a stage where you lose your scientific, like, curiosity, right? And so I love this because I get to be the researcher on this project. So Sarah Jane Jones is the PI. There's many people here who are involved. Vanda's here, Alison, Yatunde, can't see where people are. And it's a multi-method project, and James Paget is one of the new hospital build program trusts, and they've done something really upstream and really innovative and really brave. They've built a concept ward here. Here it is, a prototype ward, and they're running hospital services through the ward basically to see how it works before the new build. It's so unusual. Normally the build would happen, it would be dumped on the staff, and they just have to make the best of it. So this gives us out the way staff have to walk about, and they all talk about getting their steps in because it's so long and everything. The single room model is really a good example of that complexity of outcomes. It's great for privacy, it's great for dignity, it's great for not getting interrupted in certain ways. Families like it, they can leave their stuff everywhere and they're not in a busy bay. But it's got a real downside for at-risk patients, patients who get isolated, patients of mental health risk need to be observed, the patients with a falls risk. It's good for patients with sensory needs. So it's just not one size fits all. It's just not going to suit everybody. And patients who need to be observed can be observed through the windows here from the desk. So the idea is that the staff are at their desk and they can observe the patients one-to-one so that they keep an eye on them. So what can you see there? Because all I can see is the glare looking back at me. So the corridor lights are too bright. Whenever you dim the lights in the room, you can't see in the window. So what do staff do? They go and stand in the door. What does that mean? Well, they can't do anything else. So then you've got a staffing issue because you're basically one person short because they have to stand and observe. All they're doing is standing in the doorway. So hopefully you can see that working through. So that's an environmental example. There's a million technological issues. I won't go into that. One major one, which is, NHS thinks it's going digital, paper-free. It ain't paper-free. Still a massive amount of paperwork. Basically, it's a digital system, but everybody clutches their paper handover notes like it's the Dead Sea Scroll. And the usability analysis of the call bell system can be simplified by saying it's not used. So that's how usable it is. So there's a whole bunch of issues there. Trade-off with, that's expensive. That's expensive. So you have to work out if you want to use it, you're going to have to pay for it. And then finally, this is my favorite picture. This is a busy ward. 28 patients, full complement of nurses, healthcare assistants, visiting medical teams, 9:30 in the morning. Now, what can you see? Because I can't see anything. This is a fundamental change to the ergonomics of working. And the story at the bottom from the Health Services Journal is an old story, but the government has just decided that all new hospital builds will be single room only. So this is what they're going to look like. This is such like an important change to the way nursing in particular has worked, where you have the central mothership of the nursing station and you could see your staff and your patients, you could get a sense of things. This has implications for communication, teamwork, observing patients, seeing how they deteriorate. It has all the benefits of the single rooms too, but it sort of fascinates me that this is going to be the way forward, and it's absolutely vital that human factors people, if you like, are in there working with the teams, working with the architects, working with the designers, and talking about the ergonomics of this. So this tickles me. And so I've still got ideas. So I think this model of getting into new builds and new environments as human factors teams is what Paul and I have been arguing for a long time. We've got to move it upstream. Human factors is often, once it's all designed, you're in there trying to essentially, another metaphor, you know what I mean? But you're trying to bail water out of a whole ship. So upstream is another metaphor, right? So we're trying to get human factors into places that never used to go, with the architects, the procurement teams, the designers, and trying to essentially do good ergonomics before staff are left with environments that are not fit for purpose, technology that's not really very usable, difficult communication systems and so on. So that's an example of the discipline, I think, in its complexity and in its beauty. And Yatunde's paper's there for people to read if they're interested in more of that. And that's it. I'm going to roll the credits and mainly want to acknowledge people I've forgotten to acknowledge. But thanks very much to Claudia and Jess for today. Thanks to the Pro VC for the lovely introduction. Course director Gavin.
For audiences online to also post questions in the chat. So we'll go to...
Thank you very much, Al, for a brilliant lecture. You spoke so passionately, almost about like following your heart and doing what feels right for you at the moment. And I'm going to be a bit mean and ask, have you always followed your heart with your career? And if not, why not?
Yeah, I think the reason that I went to King's for the Patient Safety Fellowship was essentially to get back into academia. I was following the cash in consultancy and found myself telling the client what they wanted to essentially hear. So you become a bit of a service industry in that game. And so I probably had just felt that I'd lost that idea of inquiry. I still wanted, it's difficult to be a totally disinterested scientist, you know, but I still like the idea to a certain extent of going in open-minded and finding out things that potentially are unexpected. So I found that consultancy game a little bit like an end in itself, as in, well, they want us to report on that and say that. They're paying the bills, if you like, so you become a bit like a service industry. So that's probably, I found myself in that situation and probably wasn't where I wanted to be. So, you know, that's the one role. All the other roles, I think, have more or less done what I thought was fun. Yeah.
Thanks very much, Al. That was fascinating. And I just want to say thank you, but also acknowledge how fortunate we are to have you here at University of Staffordshire. Not just here at the university, but in a school which started really as a school of health when you joined. And to have a discipline like yours in a school of health, I don't think people appreciate how unusual that is. So I just wanted to acknowledge that. My question relates to your observation of the what seems to be the multiple fires that have followed in your wake throughout your career. Really, as you know, many years ago, as a very amateur, enthusiastic person looking into human factors myself, I used to watch things unfold on the TV, various disasters and plane crashes and boats sinking and things. I'd have my amateur opinion of what might have gone wrong. Is there anything in particular that you've ever watched unfold from a distance and thought, I need to be there because I'd be able to find out the answers to what's going wrong here?
Yeah, it's frequent, and most recently we charged our students with thinking about the terrible events in Washington where the helicopter flew into the glide path of a plane, and we tried to get them to take our essentially, wanted to see if they could think. And I told them what will happen is it will be put down, was it technical failure or human error? And people will try and pin it on one particular aspect. And we tried to get them to think about how actually it's, again, that complex mix. You've got different radio frequencies between the military, civil aviation, you've got fatigue, you've got someone who was in the simulator a lot but had not been flying a lot, you've got the communication in the crew, you've basically got a system instantiated in a particular situation at a particular moment in time. So these idea of complex systems, they're not abstract, they manifest themselves at a moment, but it's all there. It's not just the pilot, it's the training, the culture, the communication, the environment, you know, it was at night and all the rest of it. So so all the time I bored everybody with that, you know, anything if you like. The way the Oscar got awarded to the wrong film, do you remember that? That was a human factors system because it was like drug labeling. The two things looked identical instead of being bright orange and bright blue, you know. Sorry for colourblind, obviously, capabilities. But yeah, everything is a system that can be interrogated from a human factors perspective.
Thank you. We have a question online.
Hi, Mum.
So the question online is, you have described a better way of working, but what are the barriers to progress?
Many, and I mean, I have to defer to Paul. He's been working, you know, more or less within the NHS, although he has a part-time role here in the higher education sector, tirelessly for many years to try and get this stuff off the ground. There's all sorts, there are misunderstandings, there's siloed ways of working There are cultures about the way people are taught, you know. So you get something like, for example, Charlotte Phillips is leading on stuff around speaking up, and in healthcare, which is kind of raising concerns. It always gets approached as like an individual duty, you know, and it becomes very kind of like, you must do this because, basically telling people what to do and why it's a good idea. We're all about the how, so we always say you have to take those things and think of them as systems. How are we going to design systems that makes it easy for people to do the right thing? That's the way to get that done. But it's deeply embedded to sort of treat it as a duty. And people do that because they mean well, you know, but they think everything is to do with personal taking it on, and that burns you out eventually. So we're always trying to say there's another way to look at this. But there are many barriers. There's been a little bit of headway made, but there's also been a little bit difficulty, because essentially people pick up human factors wrong, as I mentioned right at the beginning. And so you get quite a lot of stuff that goes out with human factors in the title, but it's not really the way we would like to look at things. So that's been a barrier. You know, Paul's the person to ask about that, if you can find Paul somehow. You need to get this across at different levels. We're quite good at engaging with frontline clinical staff. You need to get into the colleges. You need to get into the educational systems. Basically, people need to learn this. My last thing I'll say is, I always argue, don't teach patient safety, right? And that's what they do. People get taught patient safety. That's the outcome. It's like teaching athletes gold medals. Today we're going to study gold medals. It's just nonsensical. What you need to teach is ergonomics. You teach clinical, you teach basic biomedical sciences, anatomy, physiology. Then you teach clinical skills, and then you teach human factors, and that's the way to get safe outcome. Patient safety is not something that you teach. It's what we're aiming for. So there's a lot of ways in which we can continue to try and gain traction, I think, you know.
Brilliant, thank you. We have time for one more question, so.
Yeah, it was nice to listen to. It makes me nostalgic for my education in Scotland. So at the end there, you spoke about the hospital with the new single room designed, sort of, you know, single patient rooms. But sort of in my experience, when you've got patients that are, say, high risks of, say, falls or accidents, you know, when they've got, say, severe, you know, sort of like care needs, all of those accidents, all of those falls occur when patients are isolated into their own single room spaces, rather than, say, in, you know, 4-bed wards, 6-bed wards. So I fail to see sort of what problem that those single occupancy rooms are really solving, when, you know, when surely the idea is to, say, prevent high-risk patients from falling.
Yep. So it's a brilliant question. Sorry, I didn't get your name or your role, but it's a very insightful question. It's just back to that idea of multiple outcomes and trade-offs. The reason I mentioned loads of people, by the way, is because they can answer the questions too. So Dr. Alison Dubé is the person that's looking at the falls data for the concept ward. So that is being examined. But just what I would say is that if you ask the falls risk person, they'll say single rooms are a big risk factor. If you ask someone who deals with people with sensory needs, autism is on, they get terribly distressed by the amount of stimulation in other rooms, they would say a single room is a great idea. If you ask families, they say it's fabulous to be able to go in, dump all our stuff. If you ask nurses who are doing medication, they don't get into giving medication, they don't get interrupted so much, so it facilitates a lot of personal care. There's privacy, dignity. The government's big flag is COVID, so the government is basically thinking of the next pandemic. Single rooms, fantastic. You can isolate people much easier. You have gender mixes in bays, so you spend all your time, a lot of my colleagues who are nurses will remember this, you have to constantly change from male to female. You don't have to do that with single rooms. You can just bring anyone in and put them anywhere. So nothing is good, bad. It's that one-size-fits-all thing. But that's the way they're going, and I totally take on board your question. I think it has implications for staffing and observing patients. The solution was to have these viewing windows, so people are in single room, but you can sit at the desk and view, but you can't see through the windows because of the lights. And I just repeat myself that it's complex, and you have to walk it through, talk it through, and you have to come up with the best trade-off, mindful decision on all the risks, and there's not going to be one solution that that mitigates all the risk to the great extent. You have to be brave and say some things are going to happen sometimes in complex systems, you know.
Last one question.
Thanks. Al, thanks for a great talk. So you've worked in a lot of higher education institutions, and one of my observations would be that HEIs are not very good at using the expertise of the specialists they have. So I'm just wondering if you've got any reflections on when you've been used to comment on the organisation that you're actually based in and how human factors can apply in that concept.
Probably, I would say a bit in COVID, Jane. We had to redesign the dental like school, and was trying to get involved in that as much as I could, stick my nose in when they were essentially putting pods around the dental chairs for isolation, and then having to change the staff ratios because they couldn't observe so many students and things. So there was a bit of that. Paul Bowie led on stuff we did on usable work procedures. Again, in the COVID time, everybody's looking for new procedures, and we were trying to help with that. But I have to say, probably we don't get asked to do that enough, and we have a standing joke about challenging our students with the usability of things like Blackboard, you know, some of our back-end systems like eVision. I always treat these as ergonomic case studies, you know, so not everything is as usable as we would like it within our administrative systems and so on. So, yeah, so we live in an ergonomic world, so yeah, we see it everywhere. But yeah, please ask us if you would like any ergonomic tips about like the new automatic system for graduate stuff. Then we're all here for you. You know?
Thanks a lot, Al. I've just realized how insufficient my introduction was. While I was mentioning your accolades, I did not mention accomplished musician, life coach, inspirational scholar, eloquent speaker, and suspected arsonist. So I apologize for the incompleteness of my introduction. I was reflecting, listening to the amazing talk, and there is someone called Faz Ahmad Faz, and none of you would have ever heard of him. Very famous poet from Pakistan, the country that I come from. He was up for a Nobel in literature the same year as Gabriel Garcia Marquez was. So Gabriel Garcia Marquez got it. But he was a lefty, so the Soviets gave him rubles and the Lenin Prize. Faz was asked what did he do in his life, and I was thinking about that, listening to your life story. And he was an amazing individual, just like yourselves. And Faz said that he broke his life into 5 to 7 year chunks. So as a young man, he taught for 5 to 7 years. The Second World War started, and he joined the British Army then as a propaganda officer and became one of the youngest lieutenant colonels in the British Army. Then he did something for UN for 5 or 7 years. He ran Pakistan's top newspaper for 5 to 7 years, was imprisoned because of a mutiny case for 5 years again. Luckily, you haven't done that bit. But Faz said that the thing that he did all his life was poetry. And I think we can say that I think you are such an amazing scholar and researcher and teacher because of the diversity of things that you have done. And it was really amazing sitting in the audience listening to that. Lastly, I want to highlight on a very personal note that in the type of role that I do, and you alluded to that a little bit, and the role that Mike does, it's easy for us to kind of, feel that we are reduced to being glorified administrators. But it's in moments like this that one realizes how fulfilling my job is, because I have the pleasure of working with colleagues like Al. So may I request you to put your hands together for Al. Thank you.